Hello everyone. I am Sanjana, onco nutritionist from ZenOnco.io. Today we shall be talking about a very important topic which is called cardiac abnormalities which could occur during a cancer treatment and what is the nutritional intervention. Because of the various cancer treatments, sometimes there can be also a cardiac abnormality which can be seen. The doctor generally terms this as a cardiac toxicity. Though it is not very common, but it is very important to understand what could be the red flags of this kind of a condition as well. So sometimes if you have been experiencing a shortness of breath or palpitations or an irregular heartbeat or even you're feeling fatigue or tiredness, then yes, it is very important to go and get a consultation from a cardiologist who will surely assess and understand if there is any you know issue or not. Now, various heart problems which are caused due to the cancer treatment can also have affect the dosage or the type of the cancer treatment which you might be receiving. It can also affect your quality of life. So, if you're going to come across any of the side effects or symptoms which are the red flags, it is very important to take the right intervention, early intervention as well, so that you can be timely treated also. Various cancer treatments, which either could be oral chemotherapy or radiation to the chest or even a targeted therapy, can also be one of the reasons why there could be cardiac abnormalities. Now, before you undergo any treatment which is related to cancer, always your doctor is going to be performing certain tests to find out if there are any underlying heart problems, or also if there is, then they need to identify the cause. Also, it is very important that to take a detailed history, a medical history, before you go for any sort of a cancer related treatment, to understand if you are having any heart related or cardiac related issues or not, because then the doctor will have to evaluate in detail in understanding what is the best approach of the treatment which can be given to you, so that even the side effects or the symptoms can be minimized as well. So, what are the common tests which are performed by the doctor to diagnose certain heart problems or check if the heart functioning is good? First of all, they will be doing a echocardiogram or an echo, and then they will also be doing a cardiac MRI as well. There are certain blood tests which can also detect certain signs of cardiac damage. So these are basically the cardiac panel markers. Most importantly, we see homocysteine levels, troponin levels, apolipoprotein levels in the body when you do the blood test. So these are some of the important cardiac markers which are going to be assessed by the doctor as well. Also, what happens is sometimes because of the underlying cancer treatment, there can be also an electrolyte imbalance which is happening, or even other minerals which are there, even their fluctuation can happen. Most importantly is calcium. Yes, hypercalcemia is something which has to be looked into, because that can also be one of the signs which needs to be seen if it is going to be a risk factor for any cardiac related abnormalities or not. Also, when you, as I earlier mentioned to you, yes, electrolytes also need to be checked. Even if you are having high levels of potassium or hyperkalemia, that can also cause sometimes arrhythmias or abnormal heartbeat, and that could also be a major risk factor for cardiac related abnormalities, and that has to be timely treated as well. So now let us go ahead and see what is the nutritional intervention, what needs to be done. Generally, when we get a patient who is undergoing a treatment related to cancer and also they are having a cardiac abnormality, the first important thing is to take a detailed nutritional assessment, screen them for risk of undernutrition, and along with that you need to also give them a cardiac diet as well, which is sodium restricted. So generally what I generally do is I recommend a soft diet which is very well tolerated for all the patients, because it does not cause much of a stress to the body as well, and also it is easily tolerable by everyone. And the thing is that your heart also gets the rest and it does not have to pump more of the blood also, which requires extra energy as well. Always check the sodium levels and also the potassium levels, because based on the condition as well and based on the electrolytes, the sodium restriction has to be given in our diet. In certain conditions or in critical condition, if the patient is going to be having a congestive heart failure, fluid intake has to be monitored so based on the doctor they'll be telling the fluid restriction. Sometimes it is anywhere between 1.5 to 2 liters of a fluid restriction which is given, and along with that it is also important to give a salt restriction of 3 to 4 grams. Emphasize on a well balanced diet which is rich in fruits and vegetables, plant based protein sources such as your tofu, pulses, and legumes, alternative sources of milk like almond milk or oats milk as well, and nuts and seeds, which are shown to be heart friendly as they contain the omega 3 fatty acids. Limit your intake of unhealthy fats, red meat, or any non-veg based sources, and also limit your intake of outside food as well. Always opt for home cooked food rather than outside processed food, as we are not sure as to what kind of a fat is used in preparing the food and also how much is the sodium in that. So, to conclude, yes, it is very important in monitoring the cardiac events as well. Early and timely intervention has to be given in case we suspect that there is any cardiac abnormality because of the cancer treatment. Not only that, nutrition plays a very important role in improving the overall health of the individual or patient, and it is also going to help in gradually improving the underlying cardiac condition as well. Thank you for watching my video, and in case of any assistance you can surely reach out to our cancer coaches on the below mentioned contact number. Thank you.